Welcome back to Insight. I'm here with Dr. Sequila Liebetrau from the Bowen Center. We're going to talk about ADHD. It's something that affects so many people, both adults and also so many children. So parents also are dealing with it. So tell people, what is ADHD, first of all?
Absolutely. So ADHD is a brain disorder. The symptoms are related to impulsivity, hyperactivity, and inattention. We tend to see it more with males than we do with females. But females absolutely can get it as well. It tends to get missed a little bit more with females because the female presentation tends to be more with inattention and not so much the jumping off the walls, where the teacher or the parents may notice that a little bit more.
So I have had friends or heard other parents talk about, well, I just don't want my child medicated. You know, they say they have ADD or ADHD and they just want to medicate them. I don't want to medicate it. Is it always treated with medication?
So there's various options for treatment. I would say the gold standard for treatment with ADHD is a combination of medication management, therapeutic intervention, and education for the parents. The medication piece, I've absolutely heard what you're saying.
Sure.
I have clients coming to me saying that I don't want my child to be a zombie, or I don't want their personality to change. Back in the day, so-and-so was on medication and I don't want that to happen to my child. These days we have a lot more options available, and the doctors are a lot more sensitive to how they prescribe. I will say, and this is important for parents to note, that if you are accurately diagnosed, depending on what research you're looking at, anywhere from 80 to 90% of folks that are accurately diagnosed get symptom relief with medication. So it really should be a consideration, along obviously with therapeutic intervention, which is where you learn skills to cope with the difficulties, such as getting organized or making schedules, and then also of course, the education piece, so that parents can learn what they're really dealing with, so they can advocate for their child at school, and so that they won't make their child feel bad about symptoms that they really can't control.
Absolutely. So if they're being diagnosed correctly and they're on the correct medication, you're not going to have, like when I was a kid and the medications first started, probably the zombie or wanting to sleep all the time and not. It's a different story.
You should absolutely not. If your child acts like a zombie, or if their personality changes, there's something wrong, and you should advocate and you should speak with a doctor and say something is not right. These days we have various options. So medications typically fall into the category of stimulant or non-stimulant. We know stimulants tend to work better and they tend to work faster. The non-stimulant is an option for parents that are maybe unwilling or scared, or for some other medical reasons their child cannot take that medication. So there are non-stimulants available. They just tend to work maybe slower or not quite as well.
So if I'm an adult, can I develop ADHD now?
No. That's the short answer, and let me explain. So the diagnostic criteria for ADHD actually states that you have to have the symptoms in childhood.
Okay.
So it does happen sometimes that a diagnosis gets missed in childhood, or the parents are opposed to medication or treatment for whatever reason. So it's possible, if we can track the symptoms back to childhood, to say really these symptoms were there all along, so it's not a new diagnosis, we're only just starting to treat it now. When we really look at the research of incidents that have been reported where people say they've developed ADHD later in life, it really comes down to it's traumatic brain injury, or it's really related to another mental health condition, or possibly substance related.
Well, if you have a child that's been diagnosed with ADHD and you need to get some help, or perhaps you think they are and you would like to get some help, all you have to do is call the Bowen Center. Give them a call today or check out their website, bowencenter.org. We'll be right back.